When it comes to the treating of anorexia, there are certain initial stops and goes that we actually have to look at. One of the things that we always have to take into consideration from the onset is the medical presentation as well as the scenario as a whole regarding the length of the struggle. Often people think an eating disorder just starts out of the blue when the signs were just hidden or unknown or just not noticeable at the time. So, a lot of people, when they come to see us and they've lost a lot of weight, we immediately safety net the scenario. We don't want to hurt them. So, we case manage what's going on. First things first, we get in touch with their pediatrician or their general practitioner. We ask for labs, medical needs. We have a conversation with that doctor as well as their own awareness. We sometimes, if there's a psychiatrist or a nutritionist involved, we actually will talk with them. And if everything is okay, and God forbid there's no hospitalization or a higher level of care that's needed, which, by the way, here at Hilltop, we do our damnedest to try to stop that. We don't want you to leave your life. Then we talk with all of those individuals and we coordinate a treatment plan. That treatment plan is something that's informed by medical, by nutrition, by psychiatry if needed, as well as the therapy component. And depending on the severity, this will involve different people and different scenarios. For many people who have children, we like to say that the family is also part of the treatment plan. This way, we can try to avoid programs, residential centers, inpatient or hospital treatment, the best of our ability. We don't want you to feel confused, and we always, by session 3 and or 4, know what's going on because it takes a little bit of time to get to know somebody. But here at Hilltop, individual therapy is key, and it's a big part of healing. Whether it's cognitive behavioral therapy, DBT, family based treatment, better known as FBT or Maudsley, trauma work, or some other type of therapy around OCD or values based reasoning, we do everything to get you matched with the proper therapist, to get the proper intervention systems, to get you properly situated and the heck on with your life. We even add a nutritionist here, our wonderful nutritionist, Maggie, who's a big part of the treatment plan if you do not have a nutritionist. And the medical checkups, she understands a lot of that and coordinates quite well with the doctors and the therapy and your family if you are needing that. So this is a lot that goes on. It's also best case scenario and the most ethical approach that you'd want any eating disorder practitioner or therapist to do. So be patient, be kind to yourself, understand this takes a little bit of time. And believe it or not, with each one of these treatment associates and professionals, there's a lot of small victories that you get to actually celebrate along the way. Recovery is possible.